All right, just like I promised, hi, my name is Samara and I am a student pharmacist and I am going to talk to you about the Zepbound vial injections. So in my previous video, I talked about if you are going to go through LillyDirect, then you can go with your doctor. I'm assuming that it didn't go through your prior authorization at a regular pharmacy. You do not want to use the coupon to get the pen at a regular pharmacy. You're looking for the cheapest option for you, but it is legit. It's not compounded. As you see, this is a Zepbound vial made by the manufacturer itself. You are going to go through to LillyDirect, which is a real online pharmacy platform that was launched by the pharmaceutical company Eli Lilly, that you see Lilly on the bottle, and that let people with valid prescription order certain Lilly medication online and have them delivered to your home. Okay, so you're gonna get 4 of these vials. This is the initial dose. You're gonna get 4 of these vials in a box delivered to your home that has ice. So you're gonna go to talk to LillyDirect online after your doctor. Remember, I told you can't just transfer it from your regular pharmacy to LillyDirect. You'll have to tell your doctor, hey, send a prescription to LillyDirect. LillyDirect, it's an online pharmacy. What they're going to do is they're either going to send you a text or you can go talk to them in the chat and say, hey, can you check if my prescription made it? You can also call them, and they're really fast. They'll start processing your prescription. When they start processing the prescription, they're going to be like, okay, follow this link and, order it to ship. It's going to be like you're buying something on Amazon. Literally, it's going to be like, okay, fill your information, your home address, your day of preference, right? And then also at checkout, you can buy this injection kit. Because remember, this is a vial. This is not a pen that's already ready to be administered. This is a vial that you're going to pull the injection from and inject yourself. You're gonna get 4 vials, okay? Remember that. Very important. And you could also at checkout for I think about $15 or maybe less, get a kit that includes 5 syringes, maybe 5 alcohol swabs, some band-aids in a Ziploc bag. They're gonna give you everything that you would need for that supply for that month. It's gonna be shipped to you. At the checkout, you could ask, which I highly recommend, that you ask for a consultation. Remember that they would not ship this medication out to you unless you talk to a pharmacist. So if you keep missing their phone call, you're going to have a delay in shipment. So make sure that if you check that out, that you're doing the consultation. Okay? Next is it ships to you. It's going to come to you home, 4 vials, and it's going to have these syringes, and it's going to be also in an ice box. So there's going to be ice on it. Take it out, put it in the fridge until you're ready to administer your first shot. My recommendation, this is not by the way, I forgot to say this is just an educational video. It's not a medical advice. Please make sure you talk to your provider. So basically, you get this box in the mail. You put your medication in the fridge because this needs to be refrigerated, right? Not frozen, refrigerated. You put it in the fridge, and I am going to show you how to give yourself the shot. So, this is the vial, right? So first of all, I always love, whenever I get a prescription or medication, anyhow, I check the expiration date. I make sure, mistakes could happen. So, I check that. Next, this is an open box. This is just an educational video, but it's going to look something similar. You're going to get this bottle, and you want to make sure before you inject yourself that it's clean. Not clean, that it's clear. Okay, you're not seeing crazy particles. You're not seeing anything crazy, not too cloudy. It's just like it feels like you could look and see. So this is just like a vial that's already been used because I'm just trying to use it for educational purposes. Next, you're checking the bottle. Everything is good. You're ready for the injection. Now I'm going to use, so this cap that's already on, you're going to pop it. And when you're gonna pop it, you're just gonna put it to the side. You're gonna put your vial down. These are kind of sensitive to light, so you kind of want to do this fast. Now I'm using a sticky note. I am not gonna use an alcohol wipe because I do not want to be wasteful of resources. I know people in some other countries wish to have some alcohol swabs right now. You're gonna swipe only once away from you. Do not air it, okay? No, because that will bring bacteria. Just one swab and let it air dry. Then you're gonna have your syringe. This is gonna come with the box. If you request, if you pay a little bit extra and get that kit, they're gonna give you these syringes with it. Now, this syringe, I see a lot of people, they just go straight in the thing. No, if you pull the air to the right amount, which is gonna be on the prescription, right? If you pull empty air to the right amount, then push that air in the bottle before you pull your dose, you're going to have, I guarantee you, you're going to have less air bubbles. This is my preferred method. So after I pull the right amount of air according to the prescription, I go in like this and then just go straight in. Okay? And then I push the air completely in. And I push it in kind of slowly because, I don't want to disturb the bottle. Then I flip it. Imagine this vial is filled with all the medication that you would need. Now, they do put a little bit of extra. They sure do put a little bit of extra. But look, this is basically water that I put in this vial. It's just to give you the real experience. And I'm going to show you that once I push that air in and I pushed out the medication, I barely had any bubbles. And this is water, okay? So with water, when you do this, you should have more bubbles. But look at that. Barely any bubbles, and there was like a tiny bubble on top. And because they give you extra medicine, I love to do that. You see what I'm saying? I got it to the right dose exactly, and I pushed the air bubbles out. Now we have kind of like a really bad pepper right here. It's not something that's edible, so I'm going to use it to show you how to inject yourself. So this is a sub-Q injection, right? Now with that, a lot of people pinch the skin, think they could go diagonal. No, because it's a tiny needle, right? You just need to kind of maybe hold your skin to feel comfortable, right? But you don't have to squeeze. And you just have to go, when you're ready, straight in. When you go straight in, I'll show you how. So basically pretend this is your belly area. You put 2 fingers from your belly button to either right or left side, and then you just go in. When you go in, it's a tiny needle, but please don't keep moving it side to side. That's gonna, hurt you. You just go straight, hold in there, or if you have somebody give you the injection, and then you just slowly push that medicine in. I like to do it slowly because if I do it fast, with any injection, that's just gonna hurt whatever you're giving. Like imagine pushing a bunch of things in. It's not gonna feel good. And then when I push till the last minute, I kind of count to like 5 or 4 seconds, 10 seconds, and pull out. And then that's it. Now, recapping the needle, you could buy these like bottles that are red from the pharmacy that you could put your injections in that you like when you do. But I do not prefer you capping it like this. I would want you to put it on the desk or on the table and do the scoop up method. Because if you just do that, you might inject yourself, right? So you want to do the scoop up method, and how we do that is not like this. This is the wrong way because you could literally do it. The scoop up method is you put the cap on here, you put a little bit of the needle in and scoop it up and then close it up. This is the injection for you. It's simple. It's easy. My biggest warning, do not think I think this was 5 milligram. No, 2.5. This is the startup dose. A lot of people, what they do is they go up a dose, okay? And they think, okay, I'm going to use the vial twice. I'm going to pull this week's dose, and then I'm going to make it last me another week. Big no, especially with LillyDirect, because if you do that, here I'm just doing the scoop up technique again for you so that, but if you do that, this bottle does not have preservative. Does not have preservative. So if you do that and you inject yourself, then you could get infection. And if LillyDirect, they sense that you're doing that, they will disqualify you from the program. Unfortunately, those don't have preservatives, so please don't do that. Get the right vial that you need. Do not go up a dose and just kind of divide up your doses. When you do this with the vial, you're literally taking out everything that you need from this vial. They will give you a little bit of extra in the vial so that you could push it out if you need. This was the educational video I had made for you for the injection for the vial through LillyDirect. Okay, this medication goes in the fridge. There's a lot of educational videos on their website on the areas of where you can inject yourself. Just make sure that you rotate your injection site, number one. And the other recommendation is that they recommend is that you are mindful of your own, this week I did this way, this week I did this way. I've also talked to a lot of people that said their injection site kind of controlled what side effect they had dealt with. This could not be factual, but like literally you pay attention. If you do it in your stomach and you feel like you're getting more nauseous, write that down. Like do what makes your body feels better. And it would not be a bad idea to step on the scale once a week when you're about to give your injection. Just try to inject yourself on the same day every week and be adherent to this medication so that you are seeing the results you're hoping for. Hopefully this video was helpful. Sorry if it's too long. Sorry if I spoke too fast. I'm just trying to give you the information that you would need if you're starting this medication. Thank you. Bye.